Our next speaker is Professor Takumi Kawaguchi. He is a hepatologist in Kurume, Japan. Professor Kawaguchi has been a leader in leading a lot of NASH studies, not only in Japan, but also globally. So he's going to address to us on the focusing on exercise therapy in NASH.
Thank you for your kind introduction. I'm Kawaguchi from Kurume University School of Medicine, Japan. First of all, I'd like to express my sincere thanks to Professor Yan for giving me an opportunity to present our work today. Today's my talk is about therapeutic strategy for NASH with a focus in exercise therapy. Physical inactivity and sarcopenia are risk factors for the development of fatty liver and poor prognosis with patients with fatty liver. Therefore, exercise is highly recommended for the patient with fatty liver by various clinical practice guidelines. Exercise can be classified into aerobic exercise or resistance exercise. In aerobic exercise, such as walking and cycling, the advantages are low cost and higher energy consumption. However, the disadvantages are that it takes a long time, causes fatigue and discomfort, and it requires high cardiorespiratory fitness. In resistance exercise, such as weight training, the advantages are that it takes a short time, increases muscle strength, mass, and body density. However, the disadvantage is that it takes special equipment. Each exercise has pros and cons. So which exercise is better to improve fatty liver? To answer this question, we have performed a systematic review using 24 aerobic and 7 resistance exercise protocols. What we found was either aerobic exercise or resistance exercise can improve fatty liver. The regimen was 40 minutes per session, 3 times per week for 12 weeks. The feature of aerobic exercise is fat burning. The feature of resistance exercise is muscle hypertrophy. Surprisingly, even though their fatty liver disappeared, approximately 50% of patients showed no body weight reduction. We performed a decision tree analysis for improvement of fatty liver. In this study, 19.6% of protocol showed an improvement of fatty liver. The most impacted factor associated with an improvement of fatty liver was male ratio. If male ratio greater than 42%, 95% of protocol showed an improvement of fatty liver. In other words, in men, the second impacted factor was the type of exercise, and 100% of aerobic exercise showed an improvement of fatty liver. So for men, recommended type of exercise is aerobic exercise. In women, 82.6% of protocol showed an improvement of fatty liver. The second impacted factor was also type of exercise. And different from men, 100% of resistance exercise program showed an improvement of fatty liver. So for women, the recommended type of exercise is resistance exercise. By the way, exercise is also important in space. In International Space Station, astronauts can spend several months. However, the problem is that astronauts quickly lose muscle mass and tone because of no gravity. if you bring a dumbbell into the International Space Station, it doesn't work at all because of no gravity. To prevent disease muscle atrophy for astronauts, we have developed a hybrid training system. It is a muscle training using voluntary muscle contraction and electrically stimulated muscle contraction. This is a scheme for hybrid training system. When you extend your knee, quadriceps, which are in the front of your upper leg, are voluntarily contracted, while hamstring, which are in the back of your upper leg, are relaxed. So the cooperation of a voluntary contraction of quadriceps and relaxation of a hamstring can lead smooth knee extension without resistance. In hybrid training, hamstrings are electrically stimulated to generate the resistance to knee extension. So in hybrid training, you need stronger contraction on the quadriceps to overcome the resistance which are generated by the electrical stimulation on the hamstrings. Why it is called hybrid training? Because there are two different types of muscle contracted. The one is agonist muscle, the other one is antagonistic muscle. Another reason is that there are two different types of exercise: voluntary contraction, aerobic exercise. Electrical contraction is resistance exercise. We have brought this system to International Space Station and attached one arm on astronaut. The other arm are free from this system. Upper images are pre-flight images, and the lower panel is the post-flight images. And you can see the increase in the muscle mass in a hybrid training system attached arm. So hybrid training system increase the muscle mass of astronauts in the International Space Station. So we wonder if the hybrid training improves fatty liver. To answer this question, we have performed a randomized controlled trial to investigate the therapeutic efficacy of hybrid training for fatty liver. We enrolled 32 patients with fatty liver who were resistant to a lifestyle intervention for 12 weeks. Patients were classified into hybrid training group or control group. In control group, patients had lifestyle counseling individually every 4 weeks. In hybrid training group, the training lasted for 90 minutes per session, twice a week for 12 weeks, a total of 24 sessions. This slide shows the patient's background. There is no significant difference in age, body mass index, abdominal circumference, and waist-hip ratio between the control and the hybrid training group. No significant difference was also seen in ALT level, fasting blood glucose level, HOMA-IL value, hemoglobin A1C level, and severity of fatty liver between the two groups. This slide shows the result of the efficacy of a hybrid training system. There was a significant reduction in serum ALT level in the hybrid training group compared to the control group. In addition, the grade of hepatic steatosis was significantly reduced in the hybrid training system compared to the control groups. Although there was no significant difference in hemoglobin A1C level between the groups, HOMA-IL value were significantly decreased in the hybrid training group compared to that in the control group. So that hybrid training improves fatty liver as well as insulin resistance. In the study, we first hypothesized that hybrid training causes an increase in muscle mass as well as an increase in resting energy expenditure, leading to an improvement of fatty liver. So we investigated changes in leg muscle mass. However, there is no significant difference in right and left leg muscle mass between the groups. In addition, there is no significant difference in resting energy expenditure between the groups. So these data indicated that an increase in muscle mass and an increase in resting energy expenditure were not the mechanisms for the habit training caused an improvement of fatty liver. So what are the mechanisms for the improvement of fatty liver? Recently, skeletal muscle is known to release various types of cytokines, and is called myokines. One of major myokine is IL-6. IL-6 is known to activate macrophages and also upregulate lipolysis in adipose tissue. Furthermore, regular exercise has been reported to increase IL-6 receptor expression and serum IL-6 level is decreased. Therefore, we investigated serum level of IL-6 in this study, and we found that there was a significant reduction in serum IL-6 level in the habit training group compared to that in the control group. We also found that a significant positive correlation between serum IL-6 level and serum ALT level and HOMA-IR value, so that habit training altered IL-6 expression, which correlated with serum level of ALT and HOMA-IR value. So these data indicated that muscle contraction causes a changes myokine, leading to an improvement of insulin resistance, resulting in an improvement of fatty liver. Thus, we found that muscle contraction rather than muscle hypertrophy may regulate myokines, leading to an improvement of fatty liver. Here I'd like to focus on the myokines. Skeletal muscle releases various cytokines called myokines. Myokines are released by a relatively high-intensity exercise. Major myokines are IL-6, myostatin, and fractalkine. IL-6 is the first identified myokine, which regulate lipolysis. Myostatin is also a myokine, which inhibits a muscle cell growth. Fractalkine is also a myokine, which inhibits the beta cell apoptosis. So downregulation of myostatin may be associated with a muscle hypertrophy, and upregulation of fractalkine may be associated with an improvement of glucose homeostasis. Previous study demonstrated that high-intensity exercise moderates myokines. However, it remains unclear if low-intensity exercise modulates myokine or not. Therefore, we investigated the effects of low-intensity aerobic exercise, such as walking, on a serum level of myostatin. Subjects are obese adults with a metabolic dysfunction. Intervention is a 30-minute walking exercise 3 times per week for 12 weeks. The outcome is changes in the serum myostatin level. And here is the result. There was a significant reduction in serum level of myostatin after aerobic exercise. So even low-intensity aerobic exercise, such as walking, reduced serum myostatin level. In last year, Gorman et al. Reported the effects of aerobic exercise on hepatic fibrosis in patients with MAFUD. In that study, subjects were biopsy-filled with MAFUD. The number was 24. The intervention was an aerobic exercise, which is treadmill or ergometer. 28 to 47 minutes per session, 3 to 5 times per week, and for 12 weeks. The outcome was hepatic fibrosis evaluated by repeated liver biopsy. And here is the result. As you can see here, about 60% of patients shows an improvement of hepatic fibrosis. So the aerobic exercise improved hepatic fibrosis in patients with MAFUDI. Next, we investigated a possible association between myostatin and hepatic fibrosis. In this study, we employed two different types of hepatic cell. And what we found is the myostatin upregulated messenger RNA expression of a collagen 1A1 in dose-dependent fashion, as like TGF-beta. We also found the myostatin upregulated messenger RNA expression of smooth muscle alpha-actin as well as TIMP1. These findings were also seen in the other hepatic stem cell, which is primarily fibroblast. So these data indicated that myostatin activated hepatic stem cell, leading to a production of collagen and inhibition of degradation of the extracellular matrix. Taken together, aerobic exercise, such as walking, improves hepatic fibrosis through the reduction of the myostatin level. Next, we examine the effects of resistance exercise on myokine. In this study, we set up a low-intensity exercise program consisting of 6 types of exercise with no requirement for special equipment and that can be performed in a small space. First, stepping, second, morning, third, lat pull down with a towel, fourth, squat, fifth, calf raise, and sixth, stretching. We name a set of these exercises as hepaticides. Just after 3 sets of hepaticides, we have examined the changes in serum level of 50 cytokines, and we found that the fructaalkine was most impacted myokine. After 3 sets of hepaticides, the serum level of fructaalkine was increased in all the subjects. Previously, Tang et al. Reported that the fructaalkine upregulates anti-tumor immunity, which inhibit tumor growth and increase the survival of tumor-bearing mice. In a previous study, by Maestro et al. Investigated an association between physical activity and risk of hepatocellular carcinoma. They found in a pan-European study of more than 450,000 subjects, physical activity was associated with a reduced risk of HCC. The risk was independent of other HCC risk factors and did not vary by age, gender, smoking status, body weight, and alcohol consumption. More notably, even in subjects with moderately inactive, the cumulative incidence of HCC was lower than the subjects with inactive. So these data indicated that even moderate or mild exercise may be beneficial for the prevention of hepatocellular carcinoma. In conclusion, either aerobic or resistance exercise is beneficial. Exercise regulates expressions of myokines. Even low-intensity exercise may alter myokines, which could contribute to the improvement of steatosis, hepatic fibrosis, as well as the suppression of hepatocellular carcinoma. Here's my collaborators, and I'd like to say thank you for all of them. Thank you for your time and attention.